Can an MRI scan explain lung cancer chest pain? If you're experiencing chest pain and are worried about lung cancer, you might wonder if an MRI scan can help explain what's going on. It's a good question because chest pain can come from many sources, and lung cancer is one of them. An MRI, or magnetic resonance imaging, creates detailed pictures of the soft tissues inside your chest. It can show the lungs, the lining around the lungs called the pleura, the mediastinum, which is the area between the lungs, the heart, and blood vessels. However, MRI is not usually the first test doctors use when they suspect lung cancer or try to find the cause of chest pain. Instead, they often start with a chest X-ray or a computed tomography scan, which is a special kind of detailed X-ray. These tests are faster, more accessible, and better at spotting small lung nodules or tumors early on. MRI is more often used later in the process, especially when doctors need to see soft tissue details or check if a tumor has invaded nearby structures like the chest wall, nerves, or spinal canal. Chest pain related to lung cancer can happen if the tumor grows and presses on or invades nearby tissues. For example, tumors at the top of the lung, called superior sulcus or pancreas tumors, often involve the chest wall and nerves, causing pain. Because MRI provides excellent contrast between different soft tissues, it can help determine if the tumor has spread into these areas. This makes MRI particularly useful in complex cases where understanding the extent of tumor invasion is important for planning treatment. Despite its strengths, MRI has limitations when it comes to lung tissue. The presence of air in the lungs makes imaging more challenging because air does not produce a clear signal in MRI scans. That's why MRI is less effective at detecting small lung nodules or early-stage tumors compared to quartz scans. Additionally, MRI scans take longer and can be more uncomfortable for some patients, especially those who have difficulty staying still or have metal implants. In summary, MRI can be a helpful tool to explain the cause of lung cancer-related chest pain, especially when there is concern about tumor invasion into the chest wall, nerves, or mediastinal structures. It is most useful when other imaging tests suggest possible involvement of soft tissues. But it is rarely used as the initial test for lung cancer diagnosis or chest pain evaluation. Instead, doctors usually relying on quartz scans and PET scans to get a full picture of the lung tissue and cancer spread. If you are experiencing chest pain or symptoms that might suggest lung cancer, it's important to see a healthcare professional. They will determine the best combination of tests based on your specific situation. Remember, no single test can give all the answers, and a comprehensive approach is always best. MRI can provide valuable information, but it's part of a bigger diagnostic puzzle that includes clinical examination, imaging, and sometimes biopsy. Always follow the advice of your medical team for personalized care.